Mortality rates. They're based on a certain number per, what is it? For what of the population?
100,000.
100,000?
Christina, can I
Okay.
just piece of paper? She is
I am, yeah.
paper. That's so important.
So what are the 7 signs of cancer? 7 warning signs of cancer, what do they include?
Lumps.
Hmm?
Lumps.
Be a little more specific in lumps.
Palpable.
Usually they are painless lumps, okay? What else?
Fatigue.
No, because you can get fatigue for everything.
That's me.
So what else? Think about the cancers you've treated. What are the symptoms that they came in with?
Some people have cough.
Yeah, coughs, okay. What else?
A change in bowel habits.
Mm-hmm. What about pain? Is that a?
No.
Okay, good, okay. So what does the TNM system evaluate? If I said the TNM of breast cancer, what does TNM stand for?
Tumor, nose, and metastases.
So T is what about the tumor?
The size.
The size, okay, and N,
How many nodes are involved?
yeah, and M,
Metastases.
okay. If I was to ask you what was the name of a cancer in the lympho-reticular system, what would you tell me? A cancer of the lympho-reticular system.
Lymphedema.
Don't overthink it.
Lymphoma.
Lymphoma.
Yeah, lymphoma. Sorry, I didn't hear that. Lymphoma, yeah. Somebody tried to tell me a little while ago it was a lymphoreticuloma. And I'm thinking, no, okay. So when we do something like radiation therapy and chemo, what is that called? If you do both of these together, what is that called?
Adjuvant care. Adjuvant.
Pardon?
Adjuvant. Adjuvant.
Adjuvant.
Adjuvant.
There's another name for it.
Concurrent.
Yeah,
Concurrent,
there you
thank
go.
you.
There you go. That's the word.
So this is to physics, guys. An atom is neutral if its number of its electrons is equal to what?
This number.
Pardon?
Protons.
Protons, yeah.
So it's atomic.
SI unit for activity. What's the SI unit for activity?
Curie.
Pardon?
Is it Curie?
Curie is not an SI unit.
Oh.
Okay, I'll give you 4 choices.
Okay, let's hear it.
Röntgen, Hertz, Curie, or Becquerel. That's because it's the only one that's an SI unit.
I was gonna say, that one here, freaking dead wrong.
Okay, so if I said to you, a TD 5/5 indicates the dose required to cause 5% chance of injury to people irradiated within what?
Just talking too fast.
Pardon?
Sorry, you talked too fast.
A TD 5/5 indicates
The dose
the
required.
dose required to cause a 5% chance of injury to people irradiated within how much following exposure?
5 years. I'm confused. Is that what you're asking? How much time?
Yeah, how much time?
5 years,
5
right?
years. That's okay, yeah,
I was like,
yeah. You just sort of said 5 years, but I don't know.
well, I thought that's what you were asking.
No,
but
that's
then I was
okay.
kind of
Yeah.
excited. I was
Strange
like,
to me, I
maybe
wasn't
not.
understanding.
So how would you make the tissue more radiosensitive? Would you increase the oxygen, increase the dose, decrease the fraction size, or decrease the volume irradiated?
More oxygen.
All together now.
We're so
Immediate
smart.
symptoms that appear after an acute radiation exposure are called what? Immediate symptoms. Pardon?
Acute.
Acute? I'll give you the choices. Latent symptoms, proportional symptoms, chronic symptoms, or prodromal. This is going back to your radiobiology.
Say that again, please.
Latent symptoms, proportional symptoms, chronic, or prodromal. So this is if you're in the middle of a radiation emergency, like somebody's dropped a bomb on you. The immediate symptoms that appear after an acute radiation exposure.
I want to guess latent, but I might be wrong. I remember this question from a practice test, but I can't remember the answer. That's the only one I remember though.
Are you Googling it, Stephen?
I am responsible for my father.
Oh, I'm sorry. Yeah,
No, you're good.
okay,
Calling you out.
Is
yeah, okay.
it's B.
So radiation sickness symptoms associated with the reduced number of leukocytes.
Wait, are we not? What's the answer? Did you tell us the answer?
Wait,
It was?
Oh.
Yeah.
Oh.
Damn,
Okay.
why didn't you say that?
radiation sickness
Latent.
symptoms associated with the reduced number of leukocytes is a major characteristic of, now you've got 4 answers here. Prodromal syndrome, hemopoietic syndrome, gastrointestinal syndrome, and cerebrovascular syndrome. Think about it. You're looking at leukocytes.
What?
Pardon? Hemopoietic?
Yeah.
Yeah, sorry, I didn't hear you say that. Okay. Any container in which radionuclides are transported, stored, or used must have a label saying what?
Radioactive materials.
Exactly. I would suggest that you read your radiobiology chapter. An HDR procedure should be performed where? And it gives you 4 choices. In a private surgical suite, in a private hospital room, bless you,
Thanks.
in a patient examination room, or a shielded vault.
Shielded vault.
When a radiation worker is away from work, it is best to store his personal monitoring film badge where? And I'll give you 4. In a safe place away from a source of radiation. Yeah, do I need to continue? No, okay. In 1 month of output of a cobalt machine, the output of a cobalt machine would reduce about how much in a month?
That's like cool.
Hmm?
Five cobalt is 5.7.
What's
Is this a
cobalt?
math question?
Can I get a calculator out for this?
You don't need a
I'll just take a
calculator.
picture of
No.
it. Did you just say
You're
14?
not doing anything,
I said
all
I
I
missed
need
14,
to know
bitch.
is how much it reduces per month. It's a percentage.
Oh.
How much the activity reduces per month.
Question.
1%. That's why you need a calculator.
Percent? 15?
This is the first note you've ever taken.
It's not. I just stopped after because I can't keep up with her. I have her final exams.
Right?
She's saying it's the first time I've ever taken notes. But I always start on my
Hey,
on the
so
on the
last week
exam
it's time
days.
to start.
I always start and try, and then I never keep up with it because I can't keep up. And I'm like, I'm just gonna watch the video because I can't.
Okay, so let's see here, where were we? Oh yeah, the target of a LINAC must have a low melting point, a high melting point, the ability to bend, or low thermal conductivity.
Hi.
High melting point, yeah.
Just throwing out fucking words.
Morgan.
What's the purpose of a flattening filter?
No.
What is a flattening filter in a LINAC? Anybody?
Balances out.
Spread the beam out evenly?
It balances out the Pauling energy of the density. So it's one flat,
Can you read the options?
across.
Yeah, okay, yeah, that would work.
Morgan.
Okay, so which of the following radioisotopes is used for diffuse bone metastasis? So we have cesium-137, cobalt-60, strontium-90, strontium-89.
You repeat the question one more time, I'm sorry.
Which of the following radioisotopes is used for bone metastasis?
No,
Shit.
used for diffuse
Diffuse.
bone metastasis.
Yeah, get it straight.
I was
Usually for
close.
prostate bone metastasis, just so that you know. Cesium-137, cobalt-60, strontium-90, or strontium-89. Anybody care to guess?
Cesium.
Wrong.
I know, I feel
We all
like it's
guessed
one of the
these
strong
two.
tans, but I don't know the
I was thinking
number.
a strong tan.
I know it was a strong tan, but I don't know what
90.
number it
Okay,
is.
so you have a 50% chance of guessing correct.
Okay,
90.
then let's just go for 90.
90.
90.
It's
Wrong.
actually 89.
See, that's what.
Okay.
So this is where you're, look at it, see if you know it, pick out the two that is impossible, and look at both of them and think, okay, which one?
It's literally one number between, like, there's not even a number between the two. They,
Yeah.
Well, just
they
think,
seem
I
so
like the way
similar.
that strong tan
Anytime they
89 sounds
Okay.
better than the
That helps.
That's that one.
Okay, so let's get
You can get
going
them
again.
so it's gonna be an uneven number.
Now I'm gonna be at the
Field
registry to see
light,
that question and
ladies
be
and
like,
gentlemen, the field light on the linear accelerator is intended to represent what? You put your field light on.
Field size.
Field size.
the beam?
Field
Yeah,
size,
the
field
treatment
area.
area, right?
Okay, yeah.
Yeah,
That's the
okay.
answer, treatment area.
The area of the radiation exposure, yes.
Okay.
That was
A scattering foil placed in the path of the beam of electrons in a linear accelerator when programmed to operate in which mode? Electrons, yeah. So what is the purpose of a positioning device? And I'll give you four.
Immobilization.
Make it reproducible.
Yeah.
Huh?
Reproducible.
Reproducible setup.
Okay, that'll work.
Wait, but you can give us the 4 answers.
Yeah, she wants word for word.
It says, make the patient comfortable. Yeah, right.
Mm-hmm.
Accommodate the most appropriate position for accurate treatment delivery. Prevent or limit patient motion during treatment or limit the setup time. So,
Yeah.
accommodate the most appropriate positioning.
Immobilization.
Because that, you see, the positioning device is not an immobilization device,
Mhm.
right? What would be a positioning device?
I want to look who decided to go up, I don't wanna hear.
Hey, girl.
Morning.
Morning.
Look who decided to show up.
What?
So should I say it?
Huh?
So I just look at another answer, should I say it? 'Cause I don't wanna-
I've been up since 4:17 this morning.
So you should have been
I
here.
know, right?
Should have been here.
The first one here. That's the top of my priority list, I'm sorry.
Sometimes
Do better.
Sometimes you
Do
go
better.
through shit in the mornings and you just can't make it. That's
Or you
okay.
just have to clean it all morning, so. My daughter was sick.
Oh,
She woke up in everything that you could imagine.
Why did you
except
come
for-
here?
Because we're reviewing today, I need to know what the hell we're studying. Well, I wasn't sure, I didn't know you were gonna do that if I'd known that.
Well, actually, Carly texted me and reminded me yesterday. I was like, oh, thank you, because I might have forgotten.
Try to relax now, take a break.
It's just gross morning. This is
Yeah,
my
that's
caffeine
right.
for today, so.
We'll send you the flashcards.
okay, where were we?
We were 22.
Positioning devices.
Scenario, ladies and gentlemen, a long cylinder loaded with radioisotope and placed in the vaginal space could be used to treat what?
A long cylinder. That's
So
exciting.
we have the choices of vaginal vault, endometrium, pelvic sidewall, or vulva.
Well, we treated it endometrium with it.
A long cylinder loaded with radioisotopes is placed in the vaginal vault. Could be used to treat the vaginal vault.
Yeah, probably.
Duh.
Yeah, I'm gonna go with that.
I'm gonna call it that now. I'm gonna call it a vault.
Stay
away from my vault.
Stop getting my vault.
Okay.
That's my vault. Yeah.
I don't like that.
You can have the code.
Okay, so,
Mallory can't have the code in my vault.
I already do, so.
an important QA test or tests associated with the light field are,
It's
So
the
who's-
light field test. It's
who's-
literally in the
well,
answer.
I'm gonna give you them.
Okay, but it's like
Um,
Give
B.
me a break.
Has everybody seen warm-up procedures on the machines?
I feel like we've all had to do it 3
So,
times.
You would use a light field to do what? Beam size accuracy, beam output, light and radiation field coincidence, or none of the above. Which ones would you can choose all of them if you wish. Beam size accuracy, beam output, light and radiation field coincidence. So which ones would you need the beam light for?
A and C.
A and
A and C.
A and C, yeah. Anybody heard of the BAT system?
Probably not.
BAT system, well, that screws that one. The BAT system uses what kind of energy to localize the treatment target? I believe I mentioned this somewhat. What kind of systems can we use to do IGRT? Give me a rundown on what kind of systems you could use to do IGRT. Huh?
The OBI.
The OBI, okay. What else? IGRT, ladies and gentlemen. One beam CT, portal
Port films?
therapy, portal imaging, and what's the other one that we don't use very much anymore?
That is
Ultrasound? Ultrasound. That is the BAT system, BAT.
What does the BAT stand for?
I know, but I can't remember what it is, but that's what it is. So it says the BAT system uses what kind of energy to localize the treatment target? It is ultrasound.
Oh, okay.
So full calibration and overhaul of treatment equipment must be carried out how often? So is it done daily, weekly, monthly, or annually? A full calibration and overhaul. So QA and preventative maintenance, how often is it done?
What are the options?
She likes that every morning.
No, I'm talking full calibration.
That's
Full
monthly.
calibration.
That's what I
So
would guess.
daily, weekly, monthly, or annually?
I would say month.
Monthly.
Annually.
Annually.
Annually,
Some of that stuff is really complicated.
yeah. They usually take the machine down for at least a couple of days. And they'll basically take it a bit, put it all back together again.
So is us a few days off.
Well, they usually do it on a long weekend. I know. Or they'll say, I need the machine by Friday lunchtime or something, so. So they usually do it over a long weekend. So, since everybody's done the QA, the tolerance of the coincidence of light and radiation field in the case of a medical LINAC is what?
You're 2 millimeters?
Pardon?
2 millimeters?
2 millimeters. Yeah. Everybody knows what I mean by a light radiation field coincidence. How's it done? Have you seen it done?
When you're lining it up in the box, what is that box?
I never thought.
Yeah.
The warm-up box, that's what I've always called
Yeah,
it.
I know what you mean by the box. So why is it called a light X-ray coincidence, or light radiation field coincidence? How can you tell if it's a light radiation field coincidence? What do you have to do? You have to do an image, or you have to do a film. And you put, we'll say it's a film, you put the film underneath the light field. You get a pin, and you put a pin prick in each of the corners of the light field. Then you process the film. It comes out and you have 4 little white or black dots where the pin pricks were. If that is exactly where the radiation field is, then your coincidence is good. You can do it also with an image.
Has it ever been off when you tested it before?
Usually the physicists do that, but yes, it has a 2 millimeter and sometimes there's 3 or 4 millimeters, so
Oh,
it has to
Is
be.
it usually like the table that's the problem? Do you know what the?
Sometimes it may be the mirror, because what does the mirror do? There's a mirror in the head of the machine. What does it do?
I see it refracts something.
When you're looking at the light field, you have a light field, there's a light bulb in the head of the machine. To get it to coincide with the X-ray field, you put a mirror, and it's usually angled like this, or like this, whichever way you're looking at it. And basically the light field skits off the mirror at the same angle as the radiation field comes down. So that the light field is made so that it looks exactly the same as the radiation field. So if somebody has done something in the head of the machine, one of the engineers or one of the physicists, and slightly knocked the mirror, then it can be off. But that of course means taking the head to bits.
That must be what I've seen in pictures online where therapists have shown pictures of something shattered in the head of the gantry, and I'm like, what the heck is that?
Yeah.
So do all of them have mirrors?
Yeah. That's the problem, you see, because if the light field goes out, then you have to change the bulb, right? And it's not easy enough to, you don't go and take the bulb out and put the new bulb in. You have to take the head, the covers off the head, and then the lead off the machine, and you have to get into the back of the head. So it's a couple hours work to change the light bulb. Anyway, where were we? Oh yeah. Localizing lasers on simulators, or for that matter, Linux, must be within
It's not the same class.
how many millimeters of isocenter?
Oh my god.
Wait, what was the question?
Localizing lasers.
That's all I got.
Localizing lasers either on a CT or a LINAC has to be within how many millimeters of isocenter?
2.
2, yeah. Usually it's within 2 millimeters, any of the lasers or the tolerances.
There's one that's only 1 though. What is that?
What?
There's something that it's only
degrees.
1.
I think that's degrees.
Degrees.
What is?
The,
For the gantry.
Okay, I just remember
Yeah.
something was 1 and the rest.
yeah, if you're doing something with the gantry, it should only be 1 degree off.
Okay.
What invention allowed IMRT to become a reality? So the answers are Cerebend, percentage depth dose, tomotherapy, MLC, or CT. MLC, yeah.
Dang,
When
that's a lot of questions.
would you use the Stirling formula? What's the Stirling formula used for? I'll give you some examples. So this is extended SSD, extended distance, equivalent square, skin gap, inverse square, Dmax, or penumbra. Which one uses the Stirling formula, if you want to use that? There's other ways to do it. It's the formula that you can use to find the equivalent square.
Oh, that's cool.
Now, that's the one that uses area and perimeter. I don't use that one, I use the other one.
What are the options again?
Extended distance, equivalent square, skin gap, inverse square, Dmax, and penumbra.
That was like 10 answers.
So it is how to find, the formula is how to find the equivalent square.
Okay. That was a lot of options.
That is a lot of options.
And that's not the one I use, but whatever works. Whatever you wish to use is fine.
It's just easier for me to remember than the other one.
So
What,
the answer is
the
equivalent
Stirling formula?
Yeah.
Okay, that's fine, whatever.
I like the other one,
I
but
like
for
the
some
other one.
reason I can only remember the area and perimeter one.
Okay, that's fine. When choosing gantry angles, which of the following is not a valid consideration? Avoidance of dose limiting structures, angles that expedite treatment time, unexecutable gantry positions, too many beams, or symmetrical arrangements. Which one is not a valid consideration?
I didn't hear that one more time.
I was watching you say it
Avoidance
and I
of
wasn't
those
listening.
limiting organs, angles that expedite treatment time, unexecutable gantry positions, too many beams, and symmetrical arrangements.
Why is there so many options on our final exam?
So you wanna know which one is not a consideration?
Is not a consideration.
Too many beans? It's either that one or what was the other one? that
Too
was-
many,
Yeah, B was the other one, I don't remember.
That would be the one that should not be a valid consideration.
not expediting treatment,
Oh,
like,
not.
not to consider.
Angles that expedite treatment times, that should not be a valid consideration. Too many beams would be a valid consideration. Okay, so if the physician changed the field size after the treatment plan has been approved, what should a therapist do? So we've got it all set up and the plan has been done, plan has been approved, everything's hunky-dory and we're ready to treat. Then the physician said, "No, hold on, I wanna change the field size." So we changed the field size. What do you do? What should you do?
You do the, what is it, the first day again?
QA?
No,
No, you have to go, it has to go back.
you have to do it.
It has to go back to like
treat
dosing and
everything.
physics.
It has to go back to
Yeah.
physics, yeah. I wanted to see what you'd say before I read them out, so.
Oh.
So it says, record the new field size and follow the plan as approved. Record the new field size and submit the change to physics for a new calculation. Reduce the monitor units by 1 if the field size has been reduced by 1 centimeter, and increase the monitor units by 1 if the field size has been increased by 1 centimeter. So you send it back to physics. You do not do anything with that. You send it back to physics. A wedge angle is determined by the tilt of the isodose lines at, so we'll have, you select 2, it says. The 50% isodose line in low energy beams, the depth of 10 centimeters for high energy beams, the depth of the 20% isodose line in high energy beams, or the depth of 5 for low energy beams. Wedge angle is determined by the tilt of the isodose lines at the 50% isodose line in low energy beams, the depth of 10 centimeters for high energy beams, the depth of the 20% isodose line in high energy beams, and the depth of 5 centimeters for low energy beams. What makes more sense?
Read the first one again.
The isodose, the 50% isodose line in low energy beams.
Does it determine the wedge angle?
The wedge angle is determined by the tilt of the isodose lines at, yes,
Bravo.
alpha and bravo. It says select 2.
Oh, shoot.
So the 50% isodose line at low energy beams and the depth of 10 centimeters for high energy beams. Okay,
That was a long
so we're
exam.
now,
That's a long exam.
80 questions.
What'd you just say?
80,
What?
0.
Wow. Why'd you
It's
guys
the final, guys.
You had us writing this stuff
Normally
down.
they're like
we were ready.
30 for finals. No?
40.
No.
Jesus.
50.
This is the final.
I mean, the 80 questions forced me to study 80 things. Not gonna lie.
Okay,
We're only at 33,
Can I have a
guys.
bagel break?
we're actually at
have a
number
pee break? 'Cause I have
42, so
to
we're
pee
halfway
break.
through.
What the fuck?
I think we're at 33.
Can we take like 5 minutes? Because I have to pee, but I don't want to miss anything.
Okay, go pee.
Thank you.
We can take 15 to 20 minutes. How does that?
Wait, Mallory's at 33 too.
Yeah, who's not at here?
She said we're at 42.
Oh, yes, thank you.
I'm at 33.
Right.
So I wrote down what
Okay.
they would be.
She missed a page.
You may have skipped some of the answers.
No.
She missed a page.
skip some?
I skipped some.
No, why would you?
What the fudge?
If she skipped them, she may have some you'll get them.
wrong.
Then we miss them.
Steven,
I'm assuming you're skipping the ones that were on midterm.
This is too much.
Yeah, okay.
Got it. You missed. What? I'm not doing that.
It's only 20 off of 100, so you missed.
Okay. So, what?
You miss 8 questions and still get an A, you're saying.
How long is this?
We can do 20 minutes if you like.
20 minutes?
Yeah.
Then I'm gonna go balls questions and I got scared.
Oh, okay.
Wait, what section is that?
Yep.
I wish I had
Anybody else want to go down and get the pens or?
Oh shoot, I do have to get my pen. I can do it after though.
I can do it later.
So you can go on Wish.
Notice I'm taking this back to my office.
We're trustworthy.
Wait. Wait, oh my god, where are you going? I have a question.
Can we follow you?
Oh, you did say chapter 9, right?
Oh, I didn't even
Yeah,
stop.
is yours a quick question, or you going in there to chat? Cause I'm gonna go in there.
It's a quick question. Yeah, you can come in. Let me pause this before you guys start talking shit about something.
So, this is breast. The entire right breast will be treated in your patient diagnosed with a T1N1M0 infiltrating ductal carcinoma. The most likely field arrangement would be what? So I'm gonna give you 4.
What was the T thing?
T1N1M0. Tangential fields with subsequent tumor bed boost. Tangential fields with internal mammary and supraclavicular fields. Parallel opposed APPA fields with spinal cord blocked. Single field electron field, the entire breast with bolus. Which would be the most
Well, it's not the
common
last.
I feel like one.
Pardon?
So, well, it's not the last one.
Definitely not.
Can you repeat
Can you repeat? Yeah. Can you repeat them again?
Tangential fields with subsequent tumor bed boost. Tangential fields with internal mammary and supraclavicular fields. Parallel opposed APPA field with spinal cord blocked. Hopefully not that one.
Yeah, I don't think that.
No.
Single field electron to the entire breast bolus.
My gut says B.
B.
That's what I say.
Why B?
Because nodes are
it?
involved.
Involved.
Your nodes are involved. Okay.
Is that right?
Mhm.
Yay.
Shoulder retractors are feasible for positioning and immobilization when treating what?
Brain.
Head and
Head.
Head and neck.
Sorry, not just brain.
Specify which part of head and neck.
neck.
Neck. Okay,
Is that right?
yes.
Okay.
Can you repeat the question?
I need to
Shoulder retractors are feasible for positioning and immobilization when treating the
Neck, thorax.
The choices were lung, whole brain, thoracic spine, and neck.
Neck.
So the only thing that you would use them on is a neck. Yeah. Scope of practice for radiation therapists could never be used in a court of law, describes the responsibilities of the therapist, can be used to defend the actions of a nurse, can be used to defend the actions of a physician. Yep,
I don't
B.
know where she started
What was
reading
B?
the answers. Because
What?
She didn't
What was B?
put a comma.
The describes the responsibilities of a therapist.
Okay.
That was the only one.
Exactly.
Those are all like that.
Go ahead.
I just didn't, like, I was writing and then kept writing, and I guess when you went over all the answers, I kept writing the answers. And I was like, I don't know where the comma goes, like, in my sentence.
Oh, I see. Scope of practice of a radiation therapist
Okay, got it.
can be, yeah, okay. A persistent threat for HIV or HBV for the healthcare provider is, what is a persistent threat for a therapist?
HIV.
HIV and HBV.
No, B, Bravo.
B, Bravo.
You just said that to piss her off, Stephen.
So what would the persistent threat, what is the thing that we do that might cause you to,
Tattoo.
pardon?
Tattoo. Tattooing?
Which is called what?
Handling needles? Bottle?
A needle stick.
Oh.
Oh.
Okay,
I got one of those.
an example of a potential source of infection would be, and I'm gonna give you some. A coworker with a cold, a visitor with a fever blister on the mouth, a patient with pneumonia, or all of the above.
All of the above.
Yeah, all of the above. Cancer cachexia. Everybody heard of the word cachexia? Is
Whole
what?
argument about it.
Malnutrition and wasting away.
Due to disease. Even.
Due to disease.
Yeah.
So
Least
if I was to
cancer
give
cachexia.
you 4 answers, an increase in appetite,
No.
an inflammatory response to disease,
Maybe.
progressive involuntary weight loss.
Yes.
Yeah.
Yes, okay. Which of the following is not considered part of the oral cavity? Buccal mucosa, hard palate, floor mouth, or soft palate? Say again? Soft palate, yeah. In treating the oropharyngeal area with IMRT, all of the following structures can be avoided except temporomandibular joint, part of the pterygoid muscles, salivary gland, or tonsils.
I thought it was tonsil. But
Pardon?
was it tonsil?
Tonsils.
You're so smart.
Thanks, man.
Oropharyngeal area
Can
avoiding
you resay like the
structures.
first 3 words of the question?
Something like that.
Say again?
Can you repeat the first 3 words of the question?
In treating the oropharynx area.
Thanks.
I'm stealing all my papers. Holy.
I got the gist.
Look at how thick that little section is that you're holding.
What?
How thick that section is that you're holding of papers.
Highest rate of nodal metastasis in all head and neck cancers is found with cancers of the oropharynx, hypopharynx, nasopharynx, and maxillary sinus.
Maxillary sinus.
Yeah.
Nasal, I thought it was nasal.
I thought it was
nasopharynx.
nasal too. Okay.
Which of the following is considered at most risk when treating the maxillary sinus with radiation? Brain, eye, skin, or pituitary? Think about treating the maxillary sinus.
The eye.
Eye.
You write something.
Histologic type of lung cancer seen in patients with no history of smoking.
Adenocarcinoma.
All together now, yeah. Okay. Initial APPA fields for lung cancer may require an anterior wedge to do what? If you're treating an APPA, an anterior wedge sometimes is put in, right? What is it doing? Why do you need a wedge in there?
Because you're sloping your chest.
The slope, yeah. Compensate for the natural slope of the chest. Most common histologic type of cancer of the stomach. Adeno is correct. Risk factor associated with colon cancer is, oh, okay. Exposure to ultraviolet radiation, diet high in salty foods, history of colon polyps,
Also that.
human papillomavirus. Which is the most common
Oh,
risk factor?
C.
Polyps.
It doesn't say that, but that's what.
That's what they mean.
So it's the polyps.
Okay.
Where is the head of the pancreas located? Normally.
In the sweep of the
Isn't
What?
it duodenum? Sweep of the duodenum.
What part?
What?
Sorry, what did you say?
The sweep
The
of
sweep.
the
Okay, all I heard
The
was.
sweep of what though? Which one was it? Is it the
sweep
stomach
of
or
the
No,
duodenum.
duodenum, you already said. I heard the duodenum and I didn't hear the sweep, so that's why I was asking for clarification. Okay, or as I would say, duodenum, whatever.
I say it different every time, so.
Yeah. Hepatocellular carcinoma
Huh?
is increasing in the incidence of the United States due to the rising cases of
Can you read them?
Epstein-Barr, Hep C, diabetes, or cholelithiasis.
Pepsi.
Hep C, yeah. Best cure in pancreatic cancer is what?
surgery?
Surgery.
What was the Hep C question again? I was writing them.
Hepatocellular carcinoma is increasing in incidence in the United
Oh.
States due to the rising cases of.
Thank you.
Which of the following cancers, even at an early stage, would involve metastatic spread throughout the abdomen?
Oh, very.
Ovarian, yeah. Which of the following pre-op tests might be used in the detection of ovarian cancer? PSA, BRCA1, BRCA2, or CA125? CA125? Yes.
Isn't there something else for BRCA2 besides breasts?
Oh, there's lots of things for
It's
BRCA.
ovarian,
Ovarian.
prostate.
Okay.
Yeah,
I think that's it.
I
but
remember
what
ovarian.
what they're asking about is the pre-op test. They wouldn't do a pre-op BRCA. Because BRCA
It's a
is
gene mutation.
done
General.
genetic.
Doesn't mean it.
Thank you.
Okay,
What question are we on to you?
to me, 61.
Okay.
62. Testicular cancers are more frequently diagnosed in men ages what?
It's like
Anybody tell me?
15 to 30.
Yep,
20 to 30.
Something like that. Yeah.
yeah,
Younger.
ish.
So what is it?
So
What?
I heard three
I heard like three
answers.
different things, so what is it?
It's like
I'm just saying ish. So somebody had said 15 to 30,
Okay.
and I said ish.
that'll probably be
So the actual, depending on the answer here is 15 to 35.
Okay.
But depending on which book you read, it can be anything from 15 to 30 to 20 to 35 to 14 to whatever. So, yeah.
Just around there.
All you have to remember is they're young.
not too young.
Most common histologic type found in prostate cancer. It's adenoma. Of the following tumors, which would require the highest dose to control the disease? Prostate, testes, penis, and breast.
Prostate.
Prostate, yeah. Total dose for irradiation of the prostate bed, total dose for the irradiation of the prostate tumor bed is what? So I'm gonna give you 4.
Like
20 to 30, gray. 30 to 45, gray. 50 to 60, gray. 66 to 75.
That one.
That one.
66
Yeah,
to
the last one.
75.
Cancers of the kidney usually arise where? The cortex, medulla, the renal pelvis, or the adrenals? Renal pelvis.
Renal pelvis.
Renal pelvis, yeah. Most bladder tumors arise in the, and it says select 3. So, posterior wall, lateral wall, trigone, neck, and urethral opening.
The first 30.
Yeah, the first.
The first 3, yeah, so that's ABC. Everybody keeping up? Okay. The most common presenting symptom of bladder cancer is what? Most common presenting symptom.
Yeah, what's it? Urticaria?
Hematuria.
Hematuria.
What is urticaria again?
Yes.
Urticaria is
Hot.
pain.
Pain?
Urticaria?
Painful. No.
That-
Painful
painful-
urination.
Yeah, okay.
What?
No, I
Urticaria.
said urticaria, but thought hematuria.
Oh,
but I
I-
was
So what's urticaria?
painful.
Isn't it hives?
It's hives.
Oh, that's what Mallory said. I'm
Hives while urinating.
Well, I guess you can have hives along with.
I know, because I kept thinking the same thing, and I've looked up urticaria like 1,000 times this last month because I kept wanting to associate it with urine as well. And then so I finally convinced myself, like, it has nothing to do with urine.
No.
okay. I'll remember that. Hopefully.
Okay. A glioma spreads by means of what? Local invasion, cerebrospinal fluid, lymph nodes, or blood.
Option 2.
See again?
What was it? What was option 2?
Cerebrospinal fluid,
For glioma.
glioma.
Local spread.
Local.
Still thinking about it.
I think it's, for glioma, I feel like it's local spread.
So what is it?
Local.
That's what I think.
What about Molly?
But what's the one?
I think
what
it's
is it?
local.
There is one.
Let's get this finished first, guys.
Yeah.
How does glioma spread?
Local.
Local.
I was supposed to say,
It
somebody
does
say
not
it louder.
spread through lymph nodes, it does not spread through blood, and a glioma does not spread down the cerebrospinal fluid. And now, Molly, what were you saying?
Which one does spread through the CNS?
There are a couple. The most common is medulloblastoma or ependymoma, occasionally. Okay. Which of the following is not a symptom of intracranial tumors? Headache, intracranial pressure, seizures, nocturia.
Doctor.
So what is nocturia?
Excessive peeing at night.
That's me. I have that.
Or excessive peeing at night,
I
yeah,
have that.
okay.
I have that in basic.
Involvement
I wake up at least
of
once a
cranial
night, but sometimes,
nerve
like, 3.
What may manifest as dysphagia?
Involvement of what?
Cranial nerve. What cranial nerve? So we have 9, 7, 6, and 5.
7. I don't know why.
7.
7 is
Did you
just.
say dysphagia?
Yeah.
For dysphagia?
Is
I'd have to write out the mnemonic thing.
Yeah, I know,
To remember it.
According to my notes, it says it is 9. What? It says it's 9. I have to
I
look.
thought 7 and 5 had to deal with the face. One had to do with like sensation.
Dysphagia. So dysphagia is what?
Gastro.
Difficulty in swallowing.
Yeah, that's the
Yeah.
also pharyngeal nerve.
Yeah, that one.
Say again?
How do you pronounce that?
But
Yeah.
I think the 11th one is the tongue.
Glossopharyngeal nerve.
Yeah,
think the
like one,
Yeah.
whatever.
Or glosso.
I'm gonna have to get a poster with the nerves on it.
Yeah.
I think, yeah, okay.
So are we going
It-
9 is the answer?
Nine.
We're
It
going-
is 9.
Okay, which of the
Yeah.
following organs atrophies after puberty? Do I have to explain? Do I have to give you a list? There's only one organ that
Thymus.
atrophies
Oh,
after puberty.
This thing,
Thymus.
The thymus, yes. Lymph nodes are of what length? So we have 4 to 6 centimeters, 10 to 15 centimeters, 1 to 25 centimeters,
1 to 25.
or 2 to 4 inches. For a
No.
lymph node? Lymph node,
A single lymph.
that's what it says.
Okay. Some of those options are pretty amazing.
I thought I
Or
remember
lymph
seeing
node,
1
that's
through
to
25 and it
confuse
being weird. Right?
So
What
what is the answer, guys?
What was the first one
What
again?
was the first option?
I got it
4 to
wrong, but
6 centimeters.
I would say that's the answer.
I feel like they're smaller than that too.
Well, I didn't see anything smaller than that. Is there anything?
1 to 25 millimeters.
Oh, maybe
that
that.
I thought you said centimeters for that one. I was like,
Centimeters.
good lord,
Okay.
it's huge.
That makes
Okay,
more
it's like a whole
sense. I remember
changing-
seeing 1 through 25 and being like,
You said
what the
state-
fuck?
Okay. Staging for Hodgkin's disease also includes an A or B grouping. Which symptom is not one of the classical B symptoms? Profuse night sweats, weight loss greater than 10% of body weight, unexplained fever above 38 degrees Celsius, and unexplained pruritus.
Right.
Pruritus.
Yeah. What is pruritus?
Itchy.
Itchiness, yeah. Okay. The most common symptom of Wilms tumors. What is a Wilms tumor, ladies and gentlemen? Pardon?
Yeah.
Kidney, pediatric kidney,
Pediatric.
to be precise, yes. So what would the most common symptom be? I'll give you hematuria, pain, abdominal mass, or nocturia.
Domino.
Yeah, I'm gonna go with thumb.
Abdominal mass, yeah. Almost at the end, guys.
Your end.
When
No, but then we're gonna
caring-
go back to that 10 that we missed, right?
Yeah.
Okay, if I can remember them, yeah. Okay. When caring for preschool age children, it is important to be authoritative and firm, make sure that they don't cry, keep communication simple and honest, and allow them to have lots of choices.
Simple and honest.
Simple and honest, yeah. And they'll basically do anything for you if you basically do it. And tell them you're not gonna hurt them. Liposarcomas originate where? Back. What
That's the only one I
feature
know.
would be present on an X-ray image of a lytic primary bone tumor? So would it be increased density in the region of the tumor, decreased density in the region of the tumor, expansion of the bony compartment, or expansion of the adjacent muscle?
Increased density.
Yeah.
Increase density, yes? Okay. Kaposi sarcoma is the most common neoplasm in those diagnosed with HIV. And a solitary multiple myeloma tumor is known as what?
Say that again.
A solitary multi-myeloma tumor is known as what? Now remember, the multiple
Plasma?
myelomas are all individual and they're all clumped in a bundle.
Plasmacytoma.
Plasmacytoma, give the lady a coconut. Yes.
What you gonna do with that?
Like a pina
Oh.
colada.
I don't know. I specifically remember because that's what my dog had, and I freaked out.
A plasma, what is it called?
Plasmacytoma.
When they told me, I was like, I've never heard of that. So thanks for.
That's what it is.
Thought it was basal
That's a
cell or
solitary-
something.
Life experience.
Solitary multiple myeloma tumor. They don't happen very often, but if they do, now there was several I missed here, guys. I'm
It was in
sorry.
between 1 and 33.
Great.
It was.
It was probably
Actually-
like 10. It was probably like, you know.
So where,
You can just hand it over to them and they'll just.
We'll figure it out.
They have it
As long as we don't
right.
have the answer key, it'll be fine to figure it out.
so I asked that.
gives it to us or not.
Oh, no, I didn't ask this one. Okay. Types of nuclear decay include all of the following except alpha decay, neutron decay, beta decay, or internal conversion.
Internal conversion.
Internal conversion, right. Okay. Okay. The energy of electromagnetic radiation is inversely proportional to its frequency, mass, speed, or wavelength.
Can you read that again?
The energy of an electromagnetic radiation is inversely proportional to its bless you.
So I'm gonna say wavelength.
But I don't know.
It's actually frequency.
Oh my god! Are you? I was like, for some reason, I feel
I
frequency.
needed 10
Sounds
points.
right.
Frequency, okay,
Inversely.
done that. Okay, so carbon 14
Oh boy.
and nitrogen 14 are they isotones, isotopes, isobars, or isomers?
Isomers.
Isomers.
How did you remember that?
I just do, because I remember carbon is 12.
Carbon 14,
Well, I remember like the base carbon,
carbon 12.
carbon 12, yeah. That's how I remember that. I just remember carbon was 12. I forgot it.
But you have carbon 14
There's a bunch
and
of.
nitrogen 14.
Right, so how did you make the leap from 12 to 14 to know what I was?
His brain worked different.
I just remember that
Sorry.
the base of carbon is 12, and I remember there being something called like a round isomer that was different.
So in other words, he just guessed.
His
That's what I
brain
guessed.
hit
But all the
different.
other options are similar sounding, that's why I'm trying to.
Yeah.
Repeat the other options.
Just
Isotones,
think about Steven.
isotopes,
No.
isobars.
Don't remember what isobar is. I know it was either isobar or isomer, and isomer sounded right.
He's like, damn it, I got it right, leave me alone.
And isobar sounds like
I'm just trying to
It's
rationalize
actually
the isomer.
isobar.
I always
Hey,
get
that's the
confused.
answer, isobar?
What?
Isomer.
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 So
Like-
you have the same.
What is an isobar?
She's like-
That's-
I was gonna tell you.
He just gotta start tuning them out eventually.
I wrote it down.
Oh,
Since it's isobars.
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 Isobar
Is the answer?
is the answer.
OMG.
Steven.
I thought you said
Wait.
bar.
So it's
Isobar.
Or isomer, I'm sorry. I thought you said
Yeah,
bar.
it's two
And
different.
what is an isomer?
so it's not
I was
isobar.
trying to tell you
It's got the
guys.
same numbers of a nucleon.
It is,
Steven, you
Interesting.
suck.
it is two different elements with the same atomic weight.
That's what it says for isomer.
That's what
Which
she
one is
just
it?
said.
Which one is it? Because I keep
It's
hearing.
isobar. Shut
Okay.
up and look it up.
Isobar. Okay.
I
Well,
just
I
remember
remember that is
the,
that's the definition.
I remember the A in isobar is supposed to be a clue
Yeah.
to what it is. I think it is
Right.
atomic.
Google don't even know what an isobar
Different
is.
elements that have the same number of nucleons.
Yeah.
Okay.
When I Google isobar, I get lines of constant equal pressure on a weather map.
Well,
Each
Yeah, that's
of
the
two
iso-
or more
that's the
isotopes
weather
of different
isobar.
elements.
look at isobar in your radiation book. See you did.
I found it.
Type
Thank
radiation
you.
after
Okay.
it.
So, we've done that one. Oh no. As the dose of radiation increases, as the dose of radiation increases, I have 4. The recovery rate in tissue remains unchanged.
No.
The tissue recovery rate decreases. The tissue recovery rate increases, or the tissue recovery rate increases until a certain dose threshold.
If the radiation the dose increases.
As the dose of radiation increases,
They would say your
Decrease,
recovery
no?
rate decreases.
Yeah.
decreases, that is correct, yes.
I thought you were like throwing us off by
Me
giving
too.
the 3 increases and 1 decrease. Like it's obvious that
No.
the answer would be decrease, but like you might
Yeah.
be trying to throw us off. Like
No, I was trying not to. I think that's all that I.
We got 5 more.
we got 5 more.
The amount of energy absorbed in a medium is expressed in units of
I thought we did the same.
Röntgen, Coulomb per kilo, sievert, or Gray.
Great.
Yours.
We have 5 more that we didn't go
I
over.
do?
Yep.
Okay. Let me just check them here. Done that one, done that one.
Do you need me to help you?
Oh, yeah. A monthly radiation exposure report says that an employee received 0.5 sieverts. If the source of exposure were to be determined to be a gamma radiation, the translation to absorb dose would be.
I'm gonna need you to repeat that one more time.
That was one you were gonna skip for us?
I was gonna ignore that one and not give you it.
Oh, well, no, to go over with us.
So you're asking what units we would use?
Well, no, I haven't got there yet.
Oh, you're still reading
I'm
it?
still reading it for people
Oh,
who pay
dang.
attention.
This is really
Okay,
long. That's what she
The
said.
monthly radiation exposure report says that an employee received 0.5 sieverts. If the source of exposure were to be determined to be gamma radiation, the translation to absorb dose would be what? I'm gonna give you them here. 0.5 sieverts equals 0.5 Gray. 0.5 sieverts equals 0.5 centigrade. 0.5 sieverts equals 10 Gray. And 0.5 sieverts equals 100 Gray.
A.
You are correct.
And that was what?
What was A again?
1 sievert is 1 gray.
Yeah, 0.5 sieverts equals 0.5 Gray. Okay. How many half-life layers reduce transmission to 2%?
I feel like there's information missing there.
No. What's a half-life?
How long it
What's
takes,
the definition of a half-life?
how long it takes for it to decay to half the amounts,
Yeah.
the original amount.
50%.
So, if you have something,
How many times down is it?
how many half-value layers to reduce the transmission by 2%?
4, 5,
Come on, teacher.
6.
Your big question.
I'm going to 50% is 1,
So for 100.
and then you go 25%, right? To
Yeah,
have 25 is
Okay, let me just
And then
repeat the
12 and a
question for
half.
him while you're thinking. How many half-value layers reduce the transmission to 2%? So it's approximately what?
I feel like 6 is right.
6.
Wow.
So there's a
Round
choice of 2, 5, 6.5, and 5.6. So I would accept either one of those.
So far.
But 5.6 is closer.
Three more.
Flattening filter we did. That one we did, that one we did. I don't think I've missed any of the others.
So there's 80
That's
questions.
6, I would put it below.
70.
Right.
Yeah, so it is
Right,
5 point,
Positioning
something,
device.
whatever you said.
We got 77.
So I missed 3 more.
I think so. Is
Tree
everybody else
no.
on 77?
Just make up 3 extra credit questions to make up for them.
What's my favorite color? What's my
Okay.
favorite tea?
And
What's your favorite color?
It was,
Yeah,
what was
bottom.
it? English morning.
English
Of course,
breakfast.
English breakfast.
Okay.
But she also likes Earl Grey, right? Didn't she say that?
Energy.
Or am I making that up? I'm making that up. Never mind.
I don't know what.
Yeah, that's what she said, right?
Did she say that?
Is that?
Okay. Maybe I'm
No,
not
it's
making
an
it up.
actual tea. It just tastes like. Wonder if she likes cat. Chamomile.
That's right.
Did that.
I see question
You can
14.
use Earl Grey for
Symptoms
summer.
that appear after acute radiation exposure. Did
Put a
that.
towel in it.
Flattening filter, we did that. Did that. I don't think I missed any other ones, guys.
Asia will tell you.
Mhm.
Mallory, were you recording from 9? Did we start right away?
Yeah, I've been recording for an hour and 16 minutes.
So I missed the first 40
Oh.
We were only like 15 questions in though. I checked each one. I was gonna take a picture. You wouldn't be
You're
able
so
to read
nice.
it, but I wasn't.
Picture, your notes?
Yeah.
Appreciate it.
That's for shit.
I think I've got everything, guys.
Do you want me to look at it for you?
Do you remember Strong? Strong question.
No, not, one.
Oh.
Remember the bat?
Yes.
Okay,
Oh,
so
yeah.
there's 4 questions. You missed one.
I think I've got everyone, guys, so.
You better.
4 questions.
You missed
Okay.
one. There's 4
Well,
questions.
there's a
I'll hit you up at the
Questions
exam if there's something I don't know.
Somebody will
Someone will alert you.
alert you of questions that we didn't
Yes, you
receive.
will. I'm
Once
sure
we
you
have
will.
once we have taken the exam.
Well, that'll just be us making our best guess on those.
If
practice
something,
for
let's put it this way, if you notice something that you didn't go over, let me know when you're doing the exam, okay?
I'll let you know.
Just great on curve to make up for those.
Okay, so, next week, as I mentioned, I need, evals, any evaluations or comps for that matter. Next week. Film badges back to me by next week. And thank you. Oh, wonderful. Thank you. And remember your pins.
Oh, yeah.
So if you don't go down and get them at the moment, go down and get them next week. Or any other time that you're here.